In this time of coronavirus, more and more people may be finding themselves dislocated from work. For a lot of folks, that also means being separated from their health insurance. There may be some coverage options moving forward, however. We'll take the next couple minutes to review a couple options for dislocated workers in Wisconsin. And let's start with public benefits with BadgerCare Plus. There is eligibility for children, parents, adults without dependent children in the home, and pregnant women to seek BadgerCare Plus coverage. Now, there are financial and non-financial eligibility requirements to become a BadgerCare Plus enrollee. The best way to evaluate your eligibility for services is to have a clear understanding of what your current monthly income is. Understanding that if you just lost your job, that current monthly income may be dropping. So go to access.wi.gov to learn more about how to sign up for BadgerCare Plus. We also, in the description below, link to our 3 Steps to Family Health Coverage guidebook, both in English and in Spanish, to help you navigate BadgerCare Plus eligibility and rules and find your way to an application quite quickly. There is also an opportunity for people losing health insurance because of a lost job to find a special enrollment period in the Obamacare Marketplace. You may qualify for a special enrollment period if you or anyone in your household lost qualifying health coverage in the past 60 days, or you expect to lose health coverage in the next 60 days. You can go to HealthCare.Gov or find a local navigator in your area to help you navigate the health insurance marketplace to see if you qualify for a special enrollment period because of lost insurance. Now, we do link, again, in the description below to some helpful resources. Covering Wisconsin here in the state of Wisconsin may be available to help you sign up for a special enrollment period plan. They also have available a toolkit that's made in partnership with the Department of Health Services to help you find out if the marketplace is right for you. Now, keep in mind that the Affordable Care Act also made it easier for dependent children up to age 26 to join the private insurance plan of their parent. Now, there are requirements about when somebody can join a parent's plan, but an open enrollment period or special enrollment period may be one of those times. So if you are evaluating whether or not you are eligible for a new marketplace plan, for example, you might see if also your dependent child might be eligible. Now, there are a little bit different rules if you are adding a dependent to a job-based plan. The timing might be a little different, so make sure you check with your human resources or job to see if that is possible. Now, finally, we wanted to remind you of some continuation coverage options that are available if you lose your job and therefore lose insurance. You could be eligible for COBRA continuation coverage, or otherwise, in the state of Wisconsin, there are continuation and conversion laws for plans that are regulated by state rules. Now, the Department of Labor will provide more information on COBRA, and we also link in the description below to some resources for continuation and conversion laws in Wisconsin to see if the plan you had when you were working may still be available to you. Now, there are some coordination and timing things you should keep in mind to see if you accept COBRA or continuation coverage, or if you should instead look to the marketplace, because the facts that lead you to considering COBRA might be the same facts that qualify you for a special enrollment period, for example, in the marketplace. You're going to want to do your comparison shopping to see which is more affordable and what coverage makes more sense for you and your family.